Hey, Dr. Emer, we're live.
Hey guys, it's Dr. Emer, and we're here doing one of my patients who has some acne scars, but he also, because of the scarring, lost a lot of mid-face volume, and I see this very frequently. I want to show you guys. See his scarring here, which we're going to treat with lasers and some other fillers, but because of that, it caused this area of his face to go down, especially on this side. I want to show you guys on this side. Take a look. Big indentation right through here. A lot of this discrepancy is because there's lost volume from the inflammation, the swelling that was there when he had the acne. So what we're gonna do now is I'm gonna balance this the best I can. Go hold this back again. There you go. I'm gonna balance this the best I can. I don't need as much on this side. We're gonna do a little pinch. And our focus is gonna be on doing this more towards his mid-face. And we're gonna work on the scars independently when we start doing the scar treatment. What that means is I'll actually go into the scars at that point. I'm gonna do a little bit here today with the Radiesse underneath, but we're gonna go more when we do the actual Bellafill long-term scarring. Okay, so you guys can see already it's a little bit lifted there. I'm gonna switch sides and hold the ice pack here out here. Good.
All right, guys, let's see what the audience has to say. Are they saying anything today?
They always do.
Let's see, guys.
So now I'm gonna go to the other side. And my focus here is, again, a little bit more of that structural building using Radiesse, which is our calcium-based fillers, one has a little more structure and lift. And you can see, you know, this is really making kind of a big impact even on the scars. Because look at that, even just that alone, what that did for his scarring. And I like Radiesse too, not only for structural building, but also for the scarring because it builds collagen there. So you can see as I pinch, there's less of that festooning, there's less of that irritation that we see because of the low facial volume. Back onto that side. Now I'm trying not to give him too much volume. We don't want him to look like his, you know, looks overdone or anything, but he does have a lot of loss, and I want him to see a difference. So we're really working to build this area more for him in sort of a mix of contour, but also foundation. Okay, hold here with your left hand. You don't need the ice pack, just hold right there. Give me that, hold right there, you're good. Okay, so you guys see already now what we need to do is fill a little bit below in that submalar, subzygoma area. Okay, so now I'm going to work into these scars and do little threads throughout. Try to get him a little lift in those areas.
Someone has acne scars on their chin and wants that treated, guys. We can help you out with that. We do combination of fillers and lasers and microneedling. You guys can send us a DM, full name, email, phone number, and we'll have our team reach out to you.
Yeah, the best you can. The best you can. Now I'm trying to get each of the areas covered so almost all of his scars get some level of improvement. Good. You can see I'm even going all the way back here, but look what that just did. Perfect. I'm having you hold here now. Right. You can use your palm. Like flat. Like, there you go. There you go. I know, no one ever knows what to do. That one down. Perfect, stay right there. Okay, so now, you can see we've definitely improved the overall look. Here, what I want to try and do is kind of throughout, is give, especially in this area where this much deeper scarring area is. Is build that volume a little bit from him. Good. Perfect. So now you see we're much more flat in texture. Okay, hold here. That hand. Perfect.
Is that Radiesse? Yes, it is, guys.
So we're showing Radiesse for both scarring and for contour. Okay. Let me see. See this end? Smile for me. See now, if you see now, none of that that line that you saw before from his scarring and his indentation is basically gone. Now look at the scar tissue. Okay, good. Hold here. Last little bit. Go ahead. Just gotta get one more needle. Scar tissue under the skin broke the needle, which is fine. All right, now I'm gonna have you take both down so I can see both sides. Just give me. Good. Oh, that's a big difference already. I need to do more over here. Okay, I want you to hold now this side for me.
Very quick.
Hmm? Clean a little. Good. So now that side's definitely more lifted where I wanted it to be. This side we need to balance it slightly. And then he has some little bit of sort of deeper scars here that we need to fill. It's not going to be 100%, but it's going to be much better. Yeah, way better. Looks really good already. And then the last thing I want to do is just do a little bit of balancing onto his folds. This is an area that scares a lot of people because they think they're going to get overdone. But we're just going to use a little hyaluronic. And that's going to just give a little lift to his mid-face because again, he has some laxity here from some looseness and some loss of volume from the acne and scarring. So this is going to help soften everything and really give a nice improvement. All right, hold on this side now. Little flat hand. There you go. Okay. And then we will now be ready to do his laser.
Someone has an appointment with us. They can't wait to see us again in New York on Thursday.
Oh, wow.
I know who it is.
Awesome.
I can tell by their name.
They're going to go live?
They are one of our filming patients.
Excellent. All right, so last thing I'm going to do is just clean him up. Get him really clean. There's always, sorry, Jordan, put that down. It's going to clean. There's always a little bit of bleeding after we work on areas of scarring. It always looks a little more swollen, but I want to show you guys, look how much improved. There's a little bit of swelling right here that will go down. We're going to have to work a little bit more when we do laser on that indentation, but look how much more flat now. This is in the old days we used to do fat grafting. This is what we used to do with fat grafting. We gave support underlying the scars. Actually, I'm going to show him on an Emer reveal. Smile for me a second so I can see. It's hard to do, I know. Okay, show him on the phone. Let's do an Emer reveal really quick.
All right.
So I'm going to show you on the phone. Obviously, it's
All right.
a mix of both scar
So you're going
and
to take the
contour.
phone. You're going to grab it, like take a side, grab the phone.
And just take a look at your overall facial structure now.
Oh wow.
Come a little bit closer, I want you to see. Now smile. I know it's hard to do. Turn that way a little bit. You see how before you had this deeper sort of creases and the big indentations through here? You see how much smaller they are?
It looks way more
Smooth.
rounded and smooth.
Yeah, that's the goal. The goal is this OG curve is what we call it. Then turn the opposite way. I want you to see this side, because this was the bad side. What do you think
Oh
now?
my god, it looks so
Isn't
much
that a
better.
big difference?
Yeah, I mean, of course, this is still some of the scars that I have, but as far
Yeah.
as like the shape of my face, it looks so
Exactly.
much better.
So now that your house has a foundation, it's flatter, it's tighter, now we can laser and it's gonna be way more improved. So now you guys, as this builds, so go ahead and let's switch them now to the regular reveal. What we can do is we can laser and then go superficial with the Bella fill. So go ahead and take that so you can see. Take a look.
Oh my god.
A little swollen, but honestly, way worth it.
Yeah.
So
Oh
folds
my
are more
God.
improved.
My face looks so much better.
Yeah, it
The
does.
shape looks so much
It
better.
really does. And there was only in a few syringes. The good thing is the Radiesse will build collagen, so we'll
Yeah.
get a nice improvement over time.
Yeah.
And I want to work a little bit more through here when the swelling, all this swelling goes down and this, then I'll be able to really tell. But smile, you can see when you smile as hard as you can, and it's hard to do. Right through here is where you're, exactly, that's the angle we want. And so this has just improved a lot. Now turn again this way. You can see, turn back that way. See how much less of an indentation through there. So we'll build this out slowly. Yeah, it's great. All right, you guys, so that's acne scar treatment with fillers plus facial sculpting, all in one. Have a good day. Good job. Sorry to be